Good morning, everybody. So I'm Jean-Michel. Forget the name, it's too complicated to pronounce. Just remember Jean-Michel, that's okay. So I'm here to talk about a pilot project we have in France. But at the same time, I just want to show you just one slide because I'm on the, so that's the title, the role of data and electronic catalogs to improve patient safety. The first part would be is about International Hospital Federation. Since I've been I'm here on the leadership team of JS1, representing this International Hospital Federation, which is it's an hospital organization representing national hospitals and healthcare systems all over the world, and sharing universal values for improved performance of healthcare services and better access to care for the population. In terms of this organization, there are some opportunities for IHF and GS1 working together. So you have here sort of different ways of working together. I can just say one or two. Mention the an IHF white paper, because we had last week or 2 weeks ago we had a meeting on the IHF National Congress and sorry, International Congress. And Fergal, one of my colleagues, Fergal here, asked the people who were in the room, how many of you know about GS1 standards? And we are very surprised to see that very, very few knew about GS1 standards. So GS1 has got to be much more well understood. Understand, these people here in the IHF are more or less managers. They are not really on the working tightly with the GS1 standards, but then there should be some sort of information given through two types of information: a white paper, writing a white paper, and explaining what what GS1 is and what we can do, and or writing a paper in their quarterly journal. That's one or two things to say. Okay, now well, I'm just talking about RESAH, because RESAH, it's a GPO, French GPO, Group Purchasing Organization, started in 2007, and it gathers something like 70, it varies from one year to another, because you know there are fusions of hospitals in France, as everywhere, so something like 150 members all around the region of Paris. They've got, and playing, of course, an important role in procurement, in healthcare procurement. Not just pharmaceutical and pharmaceutical and medical devices, but and altogether different types of procurement. There are 3 levels of activities: international, national, and regional, and this is what are the main topics of RESAH. Now, the core business is it's a regional. We are working for the region of Paris, 42,000 beds, 150 members, as I already told you. These are some data: 1.5 billion euro in terms of procurement, a partnership with the teaching hospital, APHP, which is one of the biggest in Europe. Purchasing medical and non-medical products and services. Okay, and so the business model is supported by the regional health authorities, the region of Paris. Now the project itself. So we've started this project because, as everybody said this morning, lots of different systems existing, different existing systems, information which is all scattered, nothing homogeneous. So what we wanted to do is, okay, we want to wipe all that. It's a long-term project, of course. It cannot be done in 1 year. So wipe all that and work properly and clearly. And why not work with something which exists already, which is working in the world, so with GS1 standards. So that's why we started having this. These are the objectives, more or less, of what we want. Standardize, complete product data to French hospitals, give information for clinical use, but not just for clinical use, have an effective electronic procurement, simplify all the supply chain system, and all these are listed here. These are more or less the objectives of the project. Ongoing project, of course, is the second year we are working on. The principle. You've got the suppliers here. I'm going just in one slide or two, I'm going to explain these suppliers, yes. And so they push their information system data, the information sheet, the information standards, they push that in the GDSN Paragon, GS1. Then from GDSN, go to the French data pool, which is MIPI. That's the one which has been selected for our hospitals. And MIPI is going to then send the information to the different hospitals with their own system, IT systems. Here we've got three of them. IMAG2 is a C-Page, which is another one, and of course other IT solutions. That's the principle of the system. So the idea is to share the same language. I've already told you with GTIN, GLN, and that you know that by heart now since this morning. Here are the identification of the different items that you know the same things too. So I'm not going to explain that once more. The big discussions are one product record for each product. And discussion is, Robert Moss told you this morning the difficulties in having the barcoding on each item, on each tablet, on each ampoule given to the patient. It will be the ultimate work, but for the moment we are not here. We can have the information on each bottle. Then afterwards you have got the box, the pallet, which has been already said in terms of logistics. So one standard product record. This has been, we've been working on that. 35 mandatory data have been listed, and already they are going to, this is going to work for the first time in our hospitals. And of course, trust data, best information, care and safety. That's why we work with GS1 standards, which are, of course, now the most recognized all over the world. Okay, the pilot project by itself. So why build that project? Because we want to evaluate the technical details of the implementation, demonstrate how GS1 standards can improve and make more efficient the relationship between the hospitals and suppliers. So it's a common work, and it's very interesting to have all these Friday meetings in the afternoon, Friday meetings, where we all together, providers, hospitals, you've got three or four here. You've got, of course, the military hospitals are with us, Argenteuil, Saint-Denis, Coulommiers. These are the hospitals. You've got the standard organization, you've got GS1, of course, working with us. You've got the solution provider for hospitals, MIPI, and of course, you've got the suppliers, and big ones. You've got Roche company, you've got B. Brown and Biorad, which are the first one starting the job with us. And thanks to them, so a few of them are here. I'm going to tell them to get up at the end of the session. So the pilot test scenario is here. You've started that. We did that a month ago. We've chosen one product from B. Brown, one from Biorad, and one from Roche, and we send these standard data to the GS1 GDSN, and from there to the MIPI, and the MIPI data pool sent by selection to see whether the selection worked properly or not to the different hospitals. So, for instance, if you go onto the left, eMACDO, there was an update of UriSelect Bio product, but no update of cell site, and it worked. For the second hospital, Saint-Denis, the test worked properly. We sent cell site B. Brown to the Saint-Denis, and it worked. And for the last one, update cell site for C-page on Coulommiers, and it worked together. So these are important, these pilot tests are important to do because we want to see whether the information we have is reliable. Where are we now? So first part, current actions. We've heard the pilot with different healthcare products, as you've seen. We've got, we've set up an action plan for each stakeholder to collect data. With the list of trade item description, which has been already approved and fixed for the moment. Mapping, the test scenario has been done. The description for healthcare product has been done. We've got the basic three data basic e-procurement information, clinical and supply information, and UDI compliance. And test phase between the supplier and the healthcare provider has been done. Now, what have we got to do now? Finalize the trade item description. We've got to add more information, not too much because afterwards it's going to be too complicated. We've got to maintain the test with hospitals, measurement of daily use products information data, and have, of course, more suppliers with us. So this is what's going on at the end of this year and beginning of next year. This is what the program of the end of this year and beginning of next year. So we are deeply convinced that reliable information and updated, structured comes from the companies themselves and not from other partners. And that's why we are deeply convinced that this this solution, this e-catalog, it's a beginning, is going to work. We've got to convince, of course, our national authorities for that. Thank you very much indeed. It's a short intervention. I just want to say here, with the four, Valérie is here. Can you get up, Valérie? Valérie Marchand. Where is Valérie? Is she up there? Okay. If you want to ask her questions, Valérie, thank you very much indeed. And Jean-Christophe, where is Jean-Christophe? Jean-Christophe, get up, and okay. And he is a solution provider, so if you want to ask him questions after, you can. Thanks a lot to everybody, and see you soon.